Okay. Good morning, Michelle. How's it going?
Good morning. I'm fine. How are you?
Good. It's kind of an exciting and different morning. I am closing windows instead of opening them. I am wearing a long sleeve shirt, which is very strange.
Definitely.
Kind of liking it.
I have lights on instead of my blinds open.
Yeah. Not the morning I necessarily expected, but I'll take it.
Mm-hmm.
Athena, it's raining here. So
it's very, very hot and humid here.
Okay. Looking good. The boxes are getting filled up. All right. We have a pretty full meeting today, so I probably won't wait quite as long as sometimes I do to get started. We just give it another minute or so. Good morning, Tina. Yeah, you guys you're welcome to chat until I tell you to not chat and we'll get started. But I think we're pretty much there. I think we'll go ahead and get started. Let's see. We got 23 people on. Fantastic. We'll hope for a few more to join us, but we'll go ahead and get started. So good morning, everyone, and welcome. We were just commenting on the fact that it's kind of a strange morning. I think I heard on a news report yesterday on the radio that there was a chance of snow above 10,000 feet.
What?
Yeah.
What?
And it's reminiscent. I feel like we had a similar storm, I don't know, a while back when I was camping near Alta and got caught in it. It was in August. It was in late August. So it can happen. Weird, crazy weather. All right. So let's go ahead and I'll show you what we're going to do today. There we go. This is our agenda. So we'll do our normal welcome and introductions. And Nikki, thank you for using the chat box. The chat box is such a great feature with Zoom. So feel free to use the chat to introduce yourself or ask questions or make comments throughout the meeting. If it's hard for you to unmute or you don't have that option for some reason and you do have the chat, we love using the chat. So after we do our introductions, we'll have a few announcements and updates about the medical home portal. We actually have several things to let you know about this morning. And then we'll move into our brainstorming time, which of course we love it when you take full advantage of that and bring any cases that you may be stuck on or have an update about. So be thinking about that. We're excited that today we have Codie Thurgood from the Division of Substance Abuse and Mental Health at the state to talk with us a little bit about the pediatric and adolescent mental health resources through them. And then we hope to use some of the time following her presentation to talk about kind of what you guys are doing these days in terms of, connecting your families to mental health resources. And then we'll wrap up by 10. Right, so this is our usual part, and what I'll do is just look at the attendees that Zoom tells me are here, and we'll just go down. But I'll go ahead and take full advantage of Nikki having used the chat already. So Nikki is an RN care coordinator from Busy Bee Pediatrics in Bountiful. We're glad you're with us. And then, we got a few people. I'll just go down through the chat. And if you guys don't mind muting, if you're not talking, that would be helpful. I'm hearing just a little bit of feedback. Thank you. All right, so Haley McLaughlin, I'm probably saying that wrong. She has a busy morning, but she'll try and listen in as she's able. And she's an RN in adolescent medicine at the U. Oh, Haley, that's right. We're pleased that you're able to listen in. And Kylie Richardson is pediatric RN care coordinator from Holiday Pediatrics. Good morning and welcome. Hey, Natalie Allen. She is the nurse practitioner for integrated services, Eric Christensen's program. And of course, there'll be a number of your team on the call this morning. Alyssa, I'm sorry, I can't talk this morning. Mather, RN care manager for Memorial Pediatrics. Welcome. Alicia, I'm probably saying that wrong too. Kelsey Hamadou, her audio isn't working. She's the RN with Integrated Service Program in San Juan. We always like it when Kelsey can attend. And Tina Purcells, good morning, Tina. She's with Utah Family Voices and the Medical Home Portal, and we're so pleased that you're on. Gwen Anderson is with the Integrated Services Program team. She's in Grand, Carbon, and Emery counties. So glad you're here, Gwen. Jody Birmingham, social work care manager with Castell Health. That's great. Love the social work angle. Welcome, Jody. Lexi Stanley is a new transition specialist for the ISP program. That's right, Lexi. I think I saw you on a meeting the other day. Welcome. We're happy you're here. Jennifer Goldman-Luthi. Good morning, Dr. Goldman-Luthi, Associate Professor of Pediatrics, and she is helping to oversee the Medical Home Portal and the PEDS Project Echo at the U. So we're really glad you could make it this morning. All right, so that's what I've seen in the chat. Now I'll see if I can go down through the other participants, and if you're able and you want to be on camera and unmute yourself, that's great. It helps us to get to know you a little bit better. So I'm Mindy Tueller. I manage the Medical Home Portal and the Utah Children's Care Coordination Network. Michelle, would you like to introduce yourself?
Yes, hi, I'm Michelle Redfield. I'm the administrative assistant for the Medical Home Portal, UCCCN, and several other groups. It's great to be here.
Wonderful. And I see someone who's calling in. I'm not sure if you're going to have the ability to tell us who you are, but it's an 801-768 number. We'll see if we can. Oh, great.
Hi, this is Angie at Alpine Pediatrics. I'm not sure what my connection is doing, so sorry about that. I'm Angie Richens, the Director of Behavioral Health and Case Manager for the Alpine Pediatrics group.
No apologies necessary. We're glad you're on by phone, Angie. All right, let's see, and I see, well, let's go to Athena. I'll come back to the chat in just a minute, guys. So let's go to Athena.
Hi, I'm Athena Parker with the Medical Home Portal, and I help maintain the Utah directory and then work with our state partners as well.
Great, glad you're here, Athena. And let's see, Cassie Crane, are you able to unmute?
Yeah, hi, this is Cassie Crane. I am a care coordinator at Wasatch Pediatrics South Point.
So glad you're on the call. Thank you. Let's see, how about Dora?
Good morning. My name's Dora. I'm the Professional Relations Coordinator for Shriners Hospitals for Children in Salt Lake City. Thanks.
Glad you're here, Dora. All right, Eric Christensen.
Good morning, Eric Christensen. I'm the Program Manager with the Integrated Services Program, part of the Bureau of Children with Special Healthcare Needs at the Utah Department of Health.
Good morning, Eric. All right, how about Gina Polamani?
Hi, Gina Polamani, currently family faculty with the Utah Regional Land Program.
Glad you're here. It's nice to see you. And let's see, Heidi Bates.
Hi, I would love to take my video off, but my cute little son is having a hard day today, so he's in the background. But I'm Heidi Bates, and I am a QI coach with UPIC.
No problem. Glad you're here. All right. Hey, Jade, how's it going?
Oh, good. Thanks. I'm with Healthy You Medicaid, pediatric and adult now. And of course, I have our staff meeting at 9. And so I'm glad to be here for a few minutes.
We're glad you're here too.
Great.
All right. Janelle Hendrickson.
Hi, I'm a nurse care manager. I've been working with Holiday Pediatrics, Intermountain. We've got a few new care managers that are here with us today through Intermountain. And so I'm kind of moving into more of a team lead float role. So I'm kind of a little bit everywhere, but with Intermountain Pediatrics.
Excellent. Excellent. Well, thank you for joining us. All right. Looking down the list, we've introduced a bunch of folks already. So let's go to Patty Brown.
Hi, my name is Patty. I'm a nurse care manager at the Sugar House Clinic.
Great. We're really happy you're with us. And how about Sherilyn?
Hi, this is Sherilyn. I'm the nurse care manager for Intermountain Pediatrics at American Fork.
Wonderful. Right. Welcome, welcome. Toni.
Hi, my name is Toni Estrada. I'm a care coordinator with the Integrated Services Program.
Happy you're on the call, Toni. Thanks. Okay, a couple more in the chat. Amalia. I'm going to mispronounce your last name, Amalia. Sorry, Camano. She's project coordinator with the university's UDAC clinic, and she's also part of the UPIC team with Gabby and Heidi. So welcome. And then Yvette Garcia is care coordinator at the university's general pediatrics. Glad you're here, Yvette. And Erica Wall, a new care coordinator for Tri-County Health, and you are with Integrated Services as well. You're an RN covering Daggett, Duchesne, and Uinta counties. Fantastic. Welcome. We're really pleased you're here. Okay, did I miss anyone? Allison, I see an Allison.
Yeah, I'm the care manager at Hillcrest Pediatrics.
Wonderful. Welcome. See, I'm just glancing quickly. I want to make sure. Oh, Ileana.
Hi, this is Ileana and Janet from Southwest Children's Clinic. Good morning.
Good morning, ladies. We're happy you're here.
Thanks.
Okay. All right, I think that's it. So without further ado, we'll get started. And again, just reminding you that the chat is a great way to be part of the conversation. Let's see, did I go too fast? Yes. Housekeeping, you've heard it before. If you're able to join us by computer, that's typically the best experience, gives you the most features. We'll try and end promptly by 10. All right, so we'll move into our announcements. I mentioned last month that the medical home portal team is now going to be working on the University of Utah's pediatric project ECHO. And to kick it off, we're actually collaborating with a project ECHO that's being run out of Utah State University, and they call theirs Project Scope. I always forget what the acronym is, but it's about opioid exposure and neonatal exposure to opioids. So the first session actually was Wednesday. I think it took us off guard a little bit. It did me, so I apologize that we didn't get that link sent out to you.
This is Natalie. I'm a hub member on that. It's supporting children of the opioid epidemic.
Thank you. Supporting children of the opioid epidemic. Okay, there we go. And I actually have the website up so we could go take a peek at it. But it was a really good first presentation. And I haven't been able to grab the link for the recording quite yet. I think we'll have it certainly by the time we send out a summary of this meeting for you. So if you'd like to go back and listen to it, I would encourage you to. It was Dr. Marcela Smith, who is part of the University of Utah, and she runs the Super Rad Clinic. And here are just a couple of really high level key points, key takeaways from her presentation on dependence and treatment. I wasn't able to stay for the whole hour and a half presentation. There was a case or two at the end. I'm sure that would be very interesting as well. So just to let you know, we will do a better job going forward of letting you know about these upcoming presentations that will all be around neonatal abstinence syndrome, but particularly with NOWs and around opioids specifically. So we hope you'll consider joining us for those as you're able. They happen a couple of times a month on Wednesdays at noon. I am just hearing a little bit of background noise. I wonder if somebody maybe doesn't have their connection muted. Thank you, thank you. All right. Okay. Then we wanted to talk or let Dora talk for just a minute about the Shriners Scoliosis Program. I will turn it over to you, Dora.
Thank you, Mindy. Yes, so back to school time. I just wanted to do a quick little recap on the resources at Shriners for scoliosis. As many of you know, school nurses in Utah are not required to do scoliosis screenings anymore. And with everything going on, this is very important as families are going into clinics. And one of the questions I get often from providers is, what degrees should we refer patients? And most of them are usually, oh, wait until late 20s, 30s. But at Shriners, we actually have a specialist. Her name's Sonia Rees. She's been trained. She went to school in Barcelona, Spain, to learn about the non-surgical treatment options. And so she's trained to do scoliosis therapy. And she likes to. I talked to her. She likes to start with patients at 10 degrees, and that therapy actually helps to strengthen the back and to slow down the curvature. So the main thing at Shriners is they're trying to capture it before it gets to a point where it's no return and they need surgery. So it's great that we have her here in Utah and that she's trained in that STRA system. So scoliosis specific exercises, and as you probably know, we do also have the EOS machine, which is 90% less radiation. As they're taking the imaging, their children, we're trying to less amount of radiation we can get there. And they're all next to each other. And we also have the orthotics department there that they can brace for night braces or day braces in case they do need that. But the main point is, if you have a parent that's concerned or provider that wants someone to follow through, sometimes they can start at 5 degrees and then they jump up to 14. And so if we have the availability to assist them and follow through with them, if you have anyone that's concerned or your provider is wanting us to assist one of those patients of yours. But you can always reach out to Jill, Connor, or myself if you have more questions. You've probably seen me out in the clinics, so it's been great to see you guys in person.
Hey, Dora,
yeah.
One question for you is, can you tell us the doctor's name again?
So Sonia Rees is the therapist.
Therapist, okay.
Yes.
Okay, thank you. That's a great reminder. Wonderful.
Thank you, Mindy, for your time.
All right, and as you know, we have been reminding you about the SPARK autism study. So just again, to reiterate that if you have any questions or would like any materials, whether they're digital or paper, we can get those for you. So just let me know if you are interested in more of these to help connect families you work with to this really, really cool autism study. There is, well, Amalia, do you want to say anything about this really quick?
Yeah, of course. So the Spark for Autism has been going on for a couple years now, and Heidi is also a part of this. So Heidi, if I say anything, if I misspeak, just cut in. It's a genetic study, and we're just trying to see if there's any kind of genetic link with autism. Individuals with autism, they're eligible for an Amazon gift code up to $50 per family member. And so the registration takes maybe 10 minutes. They'll receive a spit kit in the mail. So they'll collect the spit swab and then they send it back to the Spark team. And then if anything's abnormal, I do believe they will contact them. Otherwise, I don't think they get the genetic screening materials back. So that's something important to know. But if you guys have any questions about Spark or if you want more materials, I'll drop our information into the chat so you guys can refer back to that. But do you guys have any questions for me?
So it's really quick and easy, and there's no in-person part at all. And they get the $50 gift cards or codes for anyone who's participating. So it's kind of a good deal.
Yeah, thank you so much, Mindy.
Thanks. All right, so some medical home, oops, I keep doing that. I apologize. Medical home portal updates. We do have a new, wow, very touchy keypad this morning. Apologies. We have a new module on obsessive compulsive disorder. I thought it was timely given our topic this morning. I just wanted to make you guys aware of it. Let's see if I can hop out to it. Here it is. Are you guys seeing that? Are you seeing the medical home portal screen now?
Yes.
Okay, great. Sometimes I can't quite tell what's showing or what isn't. So yeah, this is a brand new diagnosis module, and just wanted to make sure that you guys are aware of it. We're trying to add to the mental health and behavioral health information on the medical home portal, and this is the latest. So please check it out. It may be very, very useful for you. All right, now we'll go to this one. Athena, do you want to do the medical home portal spotlight?
Yes, I would. I need some permissions to share my screen. There we go.
Yeah.
Got it now. Thanks.
Okay, great.
Okay, so I just wanted to highlight a little bit about how to find some mental health resources within the medical home portal. And since that's what our keynote or presenter is today. And I'm going to show you a few different ways to search. So here in the directory, I can do term searches, a service category, and location. So the first thing I'm going to search is just the words mental health authority, and show you what pulls up is a list of 46 different providers, and these are all the different county mental health authorities. So you can click here by page, or if I also do a show all, then I can use this really handy map feature to kind of scroll in on the area I want. Let's say I'm looking maybe over here in the Tri-County area. I can see that there are offices for Northeastern Counseling Center, which is the local mental health authority there in Duchesne, in Roosevelt, and also in Vernal. And if you want more information on any of those, you can click and it'll take you right to the listing for those, which shows a little snapshot of maybe some of the services that are offered at that particular location. Another way to search here is if I use, sorry, scrolling, use this combination of words in conjunction with a county name. So let's look at Fillmore. And it will pull right up the Central Utah Counseling Center for Fillmore, which is the local mental health authority there. And another way is to search the name of, so if you know that Southwest Behavioral is the mental health authority for the Southwest part of the state, you could just look up that as well. I'm going to put it in quotation marks because we use the word Southwest in a lot of other listings, and that'll narrow it down just to, there's all the Southwest behavioral health centers. And finally, just a little highlight about service categories. We have several service categories for mental health resources. So if you just start to type mental health in the service category search, you're going to see, you can narrow your search even more by adolescent care, child care, crisis care, partial hospitalization, all kinds of options here. I'll just kind of scroll through them briefly, but you can see we have lots of different categories for mental health. So if you're looking for something more specific or outside of the realm of the local mental health authority, that is a great way to search.
Tina, do you have a minute to show us how to make a list?
I would love to. However, I just sent a note over to our programmer because our list function is not working this morning. So.
Oh, okay, because I was working on it yesterday and couldn't get it to work. So maybe that's the issue.
Yeah, I just also noticed that it is not currently functioning. So we will get on that and get it working again.
Okay, thank you.
Mm-hmm.
Unmute. Thank you for pointing that out, Toni, and also Athena. We'll let you guys know when that's been taken care of. We don't want you to not be able to make a list, for sure. All right, let me share my screen again. And thank you very much, Athena, for going over those. That's great. Okay, so brainstorming time. We're a little bit short on time, but I think we've got a good 10 minutes. So why don't we make sure that you're comfortable bringing up anything that you'd like to hear. They can include difficult cases. As I mentioned before, updates on cases. We really like hearing about those. If there are any barriers you're experiencing, you know, it's kind of another peculiar time. There's a little bit of deja vu going on right now. School's about to start or has started, and we're still in this pandemic. So if anyone wants to bring up anything about that, I had made this guy smaller. I think I need to make it bigger, maybe more angry and red or something. There's also opportunities to talk with us about QI projects that you're working on, or any opportunities to use motivational interviewing. So this time is yours.
Mandy, I have a case that I'd like to talk about.
Great.
So I have a 7-year-old little boy with autism who's a runner. He was referred to me by DCFS because of that issue. He would run to a local convenience store frequently. This is a family that has Medicaid and had Cigna back in 2019. He was receiving ABA services through Utah Behavioral Services. And he had, since he was double covered, not sure how that works or if anybody's had experience with this, but Dad lost his job, lost Cigna back in March of 2019. UBS continued to give ABA services for a few months, about 4 months. And then all of a sudden they came to the family and said, you have an $8,000 bill that you need to pay, even though they had Medicaid at the time. And the family just said, well, we can't pay that. And they said, then we need to drop you. So they dropped them. The family has not been able to go back because they haven't been able to pay it. And they haven't gone anywhere else either. And so they just came to me, and we called UBS. They said they had like new people, and so we tried to talk to them, but they said no, there is in fact a bill of over $8,000 that needs to be paid before they can start receiving ABA services again. Has anybody experienced this? Should Medicaid have paid this, being the secondary, or does anybody know?
Hey, Toni, this is Eric. I'm just going to interject something here. Reimbursement for services quite often is only as good as the provider submitting a claim for payment. My question would be, did they have both insurances in the system? And if they did, were they negligent in billing those insurances? My thought would be they might be able to have some sort of a claim against the, the service provider not billing correctly back in the day. Now, I don't know how you fight that. I don't know if you need to have Medicaid on your side to hop in and help you fight that type of a thing. The kicker is at this point, I think Medicaid will only go retroactive about a year on submitting billing. So with this being 2019, I don't see how the service provider can go back and request payment from Medicaid. So it sounds like it's quite a quandary. The other question is the service provider now trying to take the family to collections or anything like that? That's what I would wonder. Or are they just sitting on this bill?
I don't think they've been sent to collections yet. I think they're just trying to bill the family directly. And as far as I know, they did have, they did know, they were aware that the family had Medicaid as well.
I guess at this point, I just don't know what the process would be to try to fight the, the outstanding balance. I just don't know if there's anybody like at Medicaid that can help them, with something like that. I mean, obviously Medicaid's not going to pay a claim that old, but if they can show eligibility at that time frame and that this provider did not bill Medicaid, then I just wonder if there's some sort of way to have an appeals or something on this. Does anybody have experience with that? Even in another, venue, not mental health or ABA therapy?
I'm agreeing with Eric on something had to have gone wrong there. If they were eligible at the time and they had their Medicaid information, it should have been billed to Medicaid. I would say this is kind of on the provider right now to figure out what they didn't do correctly.
That's kind of what I was telling Dad.
Yeah, it doesn't make any sense. And even if they had gotten a denial, they should have informed the family so that they could appeal based on EPSDT. Because Medicaid provides autism services here. So I don't understand. I mean, there's kids on straight Medicaid that are getting services just fine through UBS.
Yeah.
I mean, sorry, this is Heidi in my past life as a care manager. Sorry, some of these Medicaid, and I don't know which Medicaid they had. I don't know if it was Select Health or University, Healthy, whatever. A lot of them have a care manager or a case manager that they could probably call to say, or I know that they have a case, I know Medicaid, the state Medicaid, when you call the number, they have a caseworker that you can figure out, wasn't this in fact billed? When was it billed? Because if it's been billed, if they just billed it a year ago and it's been a year, then that's on the provider to eat that cost, is from my understanding. But that's something that I think has to be brought up to Medicaid.
Toni, this
did happen. Oh, sorry. Go ahead.
So, I mean, coming from the point of view of the orthopedic world, I talked to all the vendors for wheelchairs and IHC and our therapist, and Medicaid switches what they're wanting from the care or the doctor for them to fill out. So from what I hear from everyone right now is they are switching things so fast so that sadly they don't have to cover. So I would just be consistent, and whoever, case manager or doctor, go in and file it again with new changes. They are changing them. I hear right now they're really, really tough to work with. So I would just be consistent pushing that paperwork. And if they miss a dot on an I, that's what they're requiring, then that's what sadly we have to do. But
I guess my thought would be, did they bill Medicaid even in the first place though? Because if they didn't and they had that information, again, this goes back to the provider is what I would say. So, and how do you fight that, from Toni's point of view. So I think the thought that, the thing that Heidi brought up of talking with the care manager or the case manager, whoever is over that for the ACO. So again, Select Health or Molina or whatever they have, might be a good way to look at it.
Yeah, because my first thought is it probably didn't even get billed. It probably didn't even get billed to Medicaid would be because there should be no reason because like ABS, they would reach out to the provider and say, we need an updated prescription for ABA therapy, right? And from my understanding, and all of the other, because that's what Medicaid requires, is just an updated prescription yearly from the provider saying, yes, this child still has autism, and yes, they still need ABA therapy. But I would bet money that they didn't have Medicaid and they didn't bill it correctly, and now they're trying to backdate the bill to the parents.
So Gina Polamani put in the Medicaid constituent services number in the chat. So hopefully you can see that, Toni.
One last thing I was going to throw in as well, too, the parent should have the right to be able to see any of the billing history that took place. So they might actually need to go back and ask and say, can you show me, how these claims were processed and, what the billing history was. So, that would be a little bit of ammunition as well and supporting documentation for any sort of a claim the family might have.
Yeah, and Medicaid, and they can even ask, what did Medicaid pay, if at anything, and then you can go back to Medicaid and say, why didn't they pay this?
Well, even if Medicaid did pay anything at all, then they should just take that as payment in full, right?
Yes, yeah.
Okay.
And do you know what provider, which ACO it is?
I don't know that. No, I don't know.
Okay, that would be a good thing for them, if it's Select Health, Medicaid, or whatever it is, to, find a manager there to speak with as well and let them know that this issue is going on. And is there anything they can help with?
Okay.
I think that's very helpful.
Yes, very helpful. Thank you, everyone.
Toni, is this young fellow going to be able to get some more therapy from another provider?
I don't know. This family just moved to Brigham, and the closest place there is Utah Behavioral Services, where they were receiving services in Riverdale. And excuse me. And they really liked that place. And so he would like to go there. If at all possible, if we can fix this situation. If not, then we might need to find another place for him to go. They just have some transportation issues and things like that. So like the closest one would be, the best for this family. If we can clear this up, that would be the best thing for them to do is just to continue with UBS. So
right. Okay, well, it's time to move over into our main presentation, but I want to encourage everyone to use the listserv in between meetings. Toni, if you want to put out another request or update through the listserv, that would be great. And if there's anything else people can help with, because clearly as time passes, this young guy is not getting what he needs. So if we can help. Thank you. All right, well, I see that Codie is on the call. And so Codie, we'd love to turn the time over to you now. Sorry that we ran a little bit late. And so I can stop sharing if you have anything that you wanted to show.
I do, I have a presentation, so let me get that up.
Fantastic.
Oh, perfect. I love that it highlights to make sure I've got the right screen. All right, everything coming through great. Okay, so just as a little introduction, I'm Codie Thurgood. recently program admin instead of program manager. So that's exciting. With the Division of Substance Abuse and Mental Health, I primarily work with initiatives around 0 to 8-year-olds, but then have other tasks as assigned by my boss. And so kind of what I was asked today is, and I can show my little objectives here, is really just to give an overview of the Division of Substance Abuse or Mental Health, we call it DSAMH, kind of our referral process in our statewide system, some information about Medicaid, some impacts around children, youth, and families, and then some contact information for referrals in our system. So just to kind of, I'm very visual, so I really like having kind of a breakdown of what this actually looks like. So this is our public behavioral health partnership. So really we have the Department of Human Services that reports to the governor's office. Then within the Department of Human Services, we have my division, which is substance abuse and mental health. And then we as an agency don't do any direct service. We are just the administrative and pass-through entity for then the community level programming, which includes the local substance abuse authorities, the local mental health authorities, and the Utah State Hospital. So how that's kind of broken down is each county has an identified local mental health and local substance abuse authority. In almost all of the counties, they are located in one. There's an outlier in northern Utah where the substance use authority is actually with the health department instead of the local mental health authority. And so that one's a little bit different. So kind of our scope of DSAMH and kind of what we do, we really are around prevention and treatment services for substance abuse and mental health and making sure that they're available throughout the state. And we contract, like I said, with those county governments to provide those services. And we really just provide that oversight, that direction, and just kind of also support within, we're kind of like the in-between between government as well as our local authorities. Within that, we monitor and evaluate those services throughout the state. We do site visits, we develop area plans, we review programming to make sure that the outcomes that those authorities are doing are positive and it's reaching the concerns that we have throughout our state and in each area. We also help with technical assistance and training. We try to bring in a lot of different trainings to help build the workforce, as well as making sure that our providers have kind of the tools that they need to be able to best support the people in our state. And then we evaluate effectiveness, we communicate those results to stakeholders. We work a lot with other community partners outside of our public system and within our public system to make sure that people are aware of what's happening and kind of what our outcomes are and how we can better align. And then, like I said, the operation of the Utah State Hospital in Provo. So this is a breakdown of kind of what our local mental health authority system looks like. And so, like I said, we contract with each county. There's a total of 14 authorities because of Bear River's area being broken out into 2. And so you can kind of see that breakdown. There are many counties, especially as you get into more of the rural areas, that one entity or agency actually serves many of the counties. And that's just, it really just helps make sure that like everybody's being served and that, counties that might not have the resources can still get access to those services, even if they didn't have a direct provider in their area. So kind of our continuum of services is really, we have inpatient, residential, we have outpatient, we have crisis care, med management, psychosocial rehabilitation, including vocational training and skills development. We do case management. We do community sports with like housing and home services, like family supports and respite services. We do like case consultation as well. And like I said, we collaborate with other state agencies and public education. We work with the Board of Education and other local education authorities. And then also working with adults who are incarcerated in county facilities. So we really like from early childhood through adulthood, we have this continuum that is able to serve any needs that you know, that might arise for an individual. So this is where, like, I think I was in my job for like 2 years before I fully like wrapped my mind around the capitation system and the carve out, which we'll talk a little bit in the next slide. So really what Utah's Medicaid operates under a capitated mental health system, which means we have the PMHPs, with the exception of 2 counties. Really like that's the breakdown, but it doesn't include CHIP. So what this means in like Wasatch County and Bear River Health Department is that instead of getting Medicaid reimbursement, it's oh, what's the word I'm looking for? Pay for service. There we go. My brain wanted to not have that word. And so, you know, in Wasatch County, fee for service, there we go, that clients as they're seeing are paying instead of being reimbursed by Medicaid. And so with that, we go into the carve out system. So what this means is we have our capitated Medicaid system. So that big circle. And within that, we have a carve out of that essentially opens up any service for kids in custody, whether that's DCFS, JJS, or just DHS as a whole, that it opens up services for those youth to whether they have Medicaid or not. So it kind of gives them a special Medicaid so that they're able to access those services if they do not have traditional Medicaid. That's a very simplified thing because there's also like the carve out of the carve out, which breaks it down even more, but it really just, the focus of it is really just making sure that kids in custody are able to get the services that they need through our public system. So yeah, so all of our local mental health authorities work under this Medicaid umbrella with like the exception of the 2 that I said. And then within that, they're able to then serve additional kids outside of that traditional Medicaid. Hopefully that was a simplified version of it. I will have some time for questions at the end to go over more if there's any questions. So kind of when I was thinking about this and kind of talking with Eric and with Mindy, really trying to understand what would be useful for this group around this system. And one of the things that I kind of took away was really about this idea of coordination, that really focusing on kids and families, because that's my scope. And so it kind of broke down these important things when it comes to infant and early childhood, as well as children and youth. So for those 0 to 5 age rate, like kids 0 to 5, really the most important thing is that prevention, early intervention, and behavioral health professionals are coordinating together, that they're communicating, that they're on the same page, and that they're able to serve children, you know, through whatever needs they might have. Another thing that's really important with this is the assessments around social emotional development need to be done in every arena. It's not just a mental health thing, and it's not just a how are they engaging with their peers. It's really how a child is understanding and expressing themselves in their environment and their social world. And that those assessments can happen in any early childhood field. Whether it is early intervention, whether it's a doctor's office, whether it's prevention efforts, those assessments can be done. And so, you know, any child that might be developmentally behind can then get referrals and supports that they need, and that the parents can then get the supports that they need to best support that child and kind of get them caught up developmentally. Because what we know is that social emotional development issues in early childhood then slowly turn into mental health issues as, you know, child ages and becomes, you know, instead of a toddler, they're a child, and then into adolescence. It's also really vital that communication with pediatricians and primary care providers is happening between like behavioral health as well as the other health arenas around early childhood, to make sure that that pediatrician, because most likely, you know, kids will be seen by their pediatricians, but if the pediatrician doesn't have the tools or isn't being communicated with on the other avenues that, or other systems that might be engaging with this child and their family, then that is an opportunity that could be lost. Or vice versa, if a pediatrician is then aware of those supports in the community, they can then refer and get supports out. And additionally, wraparound supports for children and their families, especially parents and even like in, you know, other kids in the home, is so important for kids. And whether, like I'm saying, kids in general, like 0 to 18, what's the thing that's the most important is making sure that that parent-child relationship is healthy and strong, and that parents have the supports that they need to best support the child. Because what we know is that the outcomes, if we want outcomes for kids, what we need to do is improve the support and the capacity of those adults around that kid, because it's in that nurturing relationship that those outcomes can happen. And similar things for children and youth. What we know right now in our state is that there's kind of a gap between like 6 and 10-year-olds, that they aren't able to get early supports as well, because there's like kind of a lot of supports around early childhood. There's a lot of supports around adolescence, kind of like once become, you know, those yucky teenagers that we all love. That gap in between is often kind of neglected. But what we know is that 1/3 of individuals have their first mental health diagnosis or need before the age of 14. And then almost half of individuals by the age of 18, which is huge. So if we can catch that 6 to 10-year-olds, we're going to be able to then have an impact on the number of individuals needing supports into adolescence, and being able to help get those skills and get the support early. So similar things, that early identifications and referrals need to happen when we're talking about children and youth. We also need to coordinate with school supports, whether it's with, you know, their teacher, whether it's with the school as a whole, whether it's housing, food, whatever it might be. The school is a huge avenue that we need to make sure that we're coordinating around, as well as pediatricians and primary care providers again. And then again, those wraparound supports. Because if we can get supports, whether it's in home, whatever it might be, into the, you know, the home and with those families and parents, then it's going to be able to lift and support the family unit as a whole. So what I wanted to make sure that you guys had, and I'll send this out afterwards, is really the contact information for these local mental health authorities. And so in each local authority, there's an identified children's coordinator. And so they are the ones that are responsible for programming from that 0 to 18, and sometimes even transition age youth, so up to 25, 26. So the reason I wanted to kind of highlight this and give this chart to you all is to make sure that you had a kind of a warm handoff. You knew who to contact if you had questions, to even just, is a referral appropriate? Is it not? I wanted to make sure that you guys, you know, had that relationship, and it looks like I'm missing one. So I'll get you 4 corners. I'll fill that in and get that sent out. It must have not transferred over correctly. And so in all the areas. So we have all the rural areas here. We have all the urban areas. We have these individuals that are then able to connect you and you know, be able to help problem solve or coordinate, or just offer support as needed. One of the things to be aware of is Tooele County has recently changed. And so we're still trying to figure out who's a good contact for that, because right now the agency is technically Optum, which does the insurance side of things. And so they're contracting with many different providers. So I don't have one for that one right now. But if you have any concerns in Tooele County, just reach out and let me know, and I can get that, get you connected with who could help with that. So I just want to, I'm gonna, let's see, stop sharing for a second so I can see your faces. Are there any questions? That was a lot of information that I kind of dumped on you. So I want to just open it up if there's anything.
There was a question in the chat, but I think it got answered about Utah County.
Okay, let me take a look. Awesome. Yep. Yeah, so Wasatch Behavioral Health supports Utah County. The children's coordinator for that is Scott Taylor. And so, yeah, he'll be able to get you connected with supports as needed. So just the last thing too, of if there's not any other questions, really, if you have any questions, one of the most important things that we're finding is often our systems are working parallel to each other, but we're not always communicating. And so we really want to make sure that, like, you guys know, like, if you have questions, call the local or call me, like, I can help. I actually really like doing that kind of stuff. I miss direct service sometimes. And so, like, if I get to interact with people instead of just my email, I love it, make my day. So, like, reach out, let me know. And if there's someone I can connect you with, or if you're even like, hey, I've got this kid, I'm not sure what to do, give me a call or give one of the locals a call, because one of the things that we're really trying to do is open up those lines of communication and making sure that, like, any child or youth or family who's in need of support can get support no matter what avenue they start at. Whether it is, you know, through your system, whether it's through our system, that we're having that communication and the referrals. Oh, and that's what I forgot to say too, is really, like, with that, like, get releases of information, like, be able to have those things ready to go, so that we can have those communication and that back and forth, and really provide a full picture to whether it's a pediatrician, whether, you know, your agency, whatever it might be, that we can have a clearer picture. Because oftentimes, and this is speaking from I was a therapist before I moved into this position, there was a lot of times that, like, I didn't know the full picture by just getting the information for my arena, for serving them with mental health services. Sometimes I was missing, oh, hey, there's actually a health thing going on here, and that is actually impacting this mental health. But if I didn't have that coordination, I wasn't talking with primary care providers, or if I wasn't talking with DCFS and their family team meetings, I'm missing some of that information. And I'm assuming, again, you can tell me if I'm wrong, that, like, that's the same for you all as well. Like, there's components that might be missing on kind of the behavioral health side, just because that communication isn't there. And sometimes, like, I don't know the questions to ask to be able to get that information unless I'm having those conversations. So really just wanting to kind of push that, as well as that, you know, referrals are available, but also, like, if it's really just around coordination, like, releases of information are wonderful, and therapists will give you what they can and what, you know, what information might be helpful. to better support those families in the home. Because speaking again from the behavioral health therapist side, like I knew that my abilities were limited to that like 1 hour session once a week. And if I could coordinate and we could get additional services through other agencies and partners, those things that we were working on in therapy were going to be able to be improved, because they had additional supports outside of that 1 hour therapy session. Anything else? Sorry, again, just soapboxing to you all about how great therapy is and how much we want to partner with you all.
I have a zinger for you.
Okay.
So I'm Tina. I work with Utah Family Voices and with the portal, and I work directly with families a lot. And one of the zingers for me is when I get a phone call from someone who has a nonverbal child who just pretty much stumps everybody. But they do have, we do see mental health issues with our nonverbal kids. We see depression, we see, and it may come out in different ways with some kids. And do you know any really unique providers out there that have delved into that world?
Yeah, that's actually a great question. One of the projects that I've worked on in the past is really trying to develop the workforce around co-occurring intellectual and developmental delays and disabilities and that mental health side of things. And so we really tried to, there's the Utah Parent Center and Allies with Families and our office coordinated to develop a curriculum for providers on both the physical health and behavioral health side on like how to best serve those co-occurring needs. So it's an ongoing process, obviously, because it's something that there's a little bit of training and a little bit of support out there, and we're trying to get providers done. But our local mental health authorities, almost all of them have been trained on that curriculum, and so they can be a support and a resource, as well as there's new initiatives coming out that are going to open up some more avenues around that to get additional supports. So there's nothing like I can't be like, go to this person, because it's still very new, and we're still trying to develop that workforce, but great things are coming, and the local mental health authorities do have the tools to be able to help support, as well as the Parent Center, Utah Parent Center, and Allies with Families.
Okay. I would be happy to support or be in on any of those initiatives.
Perfect.
And like, we get calls from families who maybe a young man's one of their parents died. And there's just, if the child is verbal and a little bit higher level, maybe, no problem. We can find them resources. But once we get to a certain level with a kid, and that includes my son, I'm a parent, he's pretty much stumped everyone that tries to work with him, like a neuro test or it's, yeah. So, but I'm not sure. Being the parent of someone like that, it's hard to get in there. But yeah,
it is, and it's hard sometimes to fully trust that providers are going to be able to help and support, and being on the flip side, one of the reasons I'm really passionate about this and getting supports for therapists is I was a therapist that I was asked to work with cases that did have a lot of unique challenges like that, and I didn't often feel like I had the supports. And so that's one of the things that I've really am passionate about with the work that I'm doing is we've got to get therapists and providers aware and trained so that they know that they have those skills, whether it's they can do it themselves or then like referring out to community partners and knowing who to turn to. And so I appreciate that feedback, because that's really like, that what really is driving our team is really trying to help open up and train all providers to better understand those unique needs of individuals, whether, there is, developmental concerns or whether they're more neurotypical, but being able to really understand the unique needs of children and their parents.
Thanks, I appreciate that. And I think, gosh, I probably, Gina could tell me if I was at that training. I work at the Utah Parent Center under Utah Family Voices. And, but another piece to that is, with some of our more unique and non-communicating, non-verbal, or minimal communicating, there's a piece to it that some behavior is really communication, which we know that anyway. But there could be a pain piece that we're missing. And I would love to see somebody do some more study on that.
Yeah.
As well.
That would be fascinating. Like my mind's like racing now. So I think that's something like I'll definitely take back to our team and looking at with some of the new initiatives that are coming out. Because there is just so much that like if we were able to better coordinate across systems, there's so much knowledge in both systems that could then benefit, and links could be made, right? Those connections could be made between, oh, hey, there's this is how it's manifesting. And I see that in the early childhood side of things, because early childhood mental health manifests very differently than like mental health in adolescents and children, right? And even within that, like adolescent, like children's mental health still a little bit doesn't quite look like adolescent mental health, but we have everything being measured off of, the DSAM diagnosis manual that, is saying this is what anxiety looks like, this is what depression looks like. But yet what we know is that there's so many things outside of that like it is anxiety, it is depression, it is these other things, but because of age or circumstance, like they look a little bit different. And oftentimes like you have to take things into account of trauma. You have to take, all these different things and be able to step back and get a clearer picture. But if that communication and that knowledge sharing isn't happening, then kids are being missed and things are being missed. And then all of a sudden, like things have escalated and we have a bigger concern versus if we could catch it earlier.
Yeah, we should talk. We should definitely talk.
Yeah, let me throw this up really fast, because like I said, I'm visual. So let me get my contact information up for everybody.
Yeah, I'd love to give you some ideas on the whole pain thing. I've worked on that a little bit. And just thoughts on, how to do especially with some of these people, how to do individual pain assessments or pain assessments are the smiley faces you see in the ER, and a lot of kids can relate to that, but not everybody. For example, my son does not cry.
Mm-hmm.
We do not get a cry for sadness, for anything. He's cried like maybe 10 times in his 21 years. So that's so individual, because most of us cry when we're in pain, or at least we look like we're going to cry. There's something showing it. So yeah, I hope your mind is racing.
Very, very interesting. Codie, thank you so much. Guys, do you have any other questions for Codie?
Codie, this is Eric. Just one, probably this is a no-brainer, but just, help me understand. ABA therapy, that type of therapy comes as a medical benefit under Medicaid. It's not part of the behavioral health benefit. Is that correct?
Correct. Which has been, I think that's actually what has really started the conversation between co-occurring disorders and that linkage between the physical health and behavioral health. So that is one thing that really, it can only be billed under medical Medicaid instead of behavioral health Medicaid. But there's a lot of conversations that's been happening over the last few years. And I'm assuming it's going to continue to conversations are going to continue to happen as initiatives around co-occurring continue forward. And also too, to, kind of put a pitch too, if you have kids that you're working with that are preschool age, we have some preschools that do address co-occurring disorders. And so we have one in Weber and Davis County. We've got one in Salt Lake County. We have one in Utah County, and then we have supports and services in kind of like the Southwest Utah side of things. So like essentially that bottom part of Utah, which those preschools, most of them, with the exception of Salt Lake, have multiple or I guess Salt Lake does too. They have multiple classrooms. So they're serving many different kids and have, opportunities there to help support young kids with that early intervention piece of co-occurring mental health and ID or DD. And within that, they're also very, very great at transition planning as those kids get ready to transition into a traditional school setting, or if there's a different school setting that they need to transition to. And they're also really great at coordinating with, our primary care providers and other agencies that might be involved with a family. And so if you want specifics on that, just reach out and let me know. I'd love to get you in contact with them. They're I love working with kids. So they're one of my favorite programs that I oversee, just because you get to see so much growth of those kids as they're kind of learning and figuring out how to navigate their world, and that these providers are helping address both of those co-occurring needs. And they do, Eric, what made me think about it is they do a lot of ABA within those preschool programs as well.
Codie, if you wouldn't mind just sending those to me,
yeah,
and then we can make sure that they're in our services directory for the medical home portal correctly.
Okay.
Gina's put something up on the chat too at the Utah Parent Center's website about the dual diagnosis. Great, that you were referring to before with the Allies for Families, et cetera. Okay, thank you, Gina. We'll make sure that goes out in the notes as well. So.
Perfect.
Great. Okay. Wonderful. Thank you.
Thank you guys
so much. All right. Well, guys, we have a few minutes left, and we'd very much like to hear about what you are doing, not necessarily for your families that qualify for Medicaid and services that Codie's been discussing, but kind of the whole thing. How are things going? How are you trying to meet the needs of the families you're working with right now around mental and behavioral health? Does anyone want to bring something up?
Can I just ask a question to the group? Some of you folks from your pediatric practices or wherever, if you have a kiddo that I'm not thinking kid in crisis, like you get through the ER or you need to take care of right this second, but if you have a kiddo that you think would benefit from counseling or something like that, what is your typical time frame for getting folks into behavioral health services? And I'm not talking just necessarily Medicaid, but what about somebody who has a private insurance and this kid could benefit from some ongoing therapy or support? What's your typical when you try to make that referral, what's your typical turnaround time for somebody to say, we can get this kid seen within X number of days, weeks, months, etc.?
Hi, this is Angie from Alpine Pediatrics. Eric, to answer your question specifically, and I don't know how everybody else is working through a general, what I feel like is just shortage of providers and ability to get kiddos in what feels like a timely manner. With our program, we have a couple of psychologists, and those are booked out further than our social workers. Our social workers, we can typically get people in within, a few weeks. And our psychologists, though, are months out. And we struggle with not only do I get you in for an initial, but how quickly can I get you in to start accomplishing that treatment plan with regularity? And so we're continually trying to kind of sort that out, within our practice and model. And part of that answer for us has been to develop a collaborative care model, and where we have taken on a child and adolescent psychiatrist, Dr. Matt Swenson, in a consulting capacity, to work together with care managers, the psychiatrist, the therapist, and the primary care physician, so that we can help these kiddos, get well faster, reach their goals faster, optimize medications faster. And right now, I mean, we're certainly, taking on new patients to the clinic in general, but we've had to limit that service to Alpine Peds patients just so that we can meet the need well. And hopefully someday, I can open that up, at least our therapy part of it. But in order to stay collaborative, we need to keep, have the services kind of under our umbrella so that we can easily communicate with the physicians and those providers. We do participate or communicate with outside therapists when our patients are seeing somebody else in the community, though. The care manager will do that under the collaborative care model.
So interesting. Thanks, Angie. Anybody else able to answer Eric's question about timeframes to getting patients connected with resources?
I'm taking the silence to mean that it's probably pretty tricky for everybody to get kids into behavioral health services. I can just speak from a personal perspective. Several years ago, when my oldest will be 30 in December. Yes, folks, I am that old. When he was a kid, when he was in second or third grade, we had to get him into some counseling stuff, and it took us a little bit of time to get him in through an Intermountain, the facility in Taylorsville, to get in. But once we got on some services, we were able to schedule with regularity. It was just that initial getting that first appointment that took us just a little bit. Mm-hmm. I'm assuming, is that the case for most of you, that getting that first appointment is tough, or is even getting scheduled for the ongoing, therapy for a kiddo, is that still tricky as well?
Hey, this is Angie again. We definitely find that getting them in initially can be tricky, and we have an acuity system that helps us know, hey, this is a kiddo in crisis versus a routine follow-up that helps us, and then a couple of levels in between that help us schedule accordingly. One of our biggest struggles is, I can get people in quicker with my social workers, but there's a lot of insurances that don't recognize them. And will only cover psychologists, which overburdens my psychologist schedules and leaves my social workers more open But man, I wish I had a great answer and a way around that. COVID was good to us in that sense, and that a couple of insurances recognized, you know, the increasing mental health needs and were kind of relaxed their restrictions on social work. Cigna was one of them, and normally they're pills to deal with. So, you know, that was helpful, and they continued that. Hopefully it will continue long term, but I think insurances in general make it really difficult for people to access the kind of care they need to.
This is Janelle from Intermountain. I was just going to mention for holiday pediatrics, for the kids that we get referred for some to have care management kind of help them find behavioral health, we're finding big challenges as far as, you know, we're seeing that insurance difficulties, but also giving them a list of providers. I'll give them a list of like 5 or 6, and they'll still be on wait lists for months. So we're definitely seeing an increase in difficulty just even with that initial appointment, and parents having to do a lot of calling and, you know, reaching out to different providers because there is just so many that are full right now.
Sounds like some confirmation, Eric.
Yeah, and you know, I don't know. I guess sometimes maybe it's just a rhetorical question. I mean, what can you do about it? There is definitely a dearth of, you know, behavioral health providers out there, and we definitely know that there's an increased need for this, particularly in a COVID environment. You know, kids are coping with some really bizarre things in social isolation that they might not have dealt with before. So anyway, I guess by asking the question, I hope somebody had, you know, the recipe for the secret sauce for getting, you know, somebody into behavioral health, or just some really great things, but it sounds like everyone is struggling with that. And I know historically that has been a problem, and it continues to be. I think Andrew brings up a great point, though. With a dearth of social workers, it would really be great if I'm a social worker with psychologists. It would be really great if we could have, you know, some LCSW folks recognized, you know, at similar in a similar way as psychology. I don't know how you go about fighting the big insurance companies on that either.
You get Pat Rowe involved.
Yeah, Pat is the big guns, isn't she?
Okay, well, if there isn't anything else, we can certainly wrap up a little early. Somebody's got something in the chat. Sylvia. Yeah, parents that have low literacy levels, language barriers, other barriers, phone, computer issues, those kinds of things. Yeah, it's really hard. It's really hard. So if anybody has ideas.
I have something.
Go ahead.
Right now, just based on what you said, if you do have families out there that do not have a device or do not have access to the internet, which there are programs out there right now too, as well, federal programs for internet that help. But currently Utah Family Voices has, which that's where I work, we have some grant from over COVID to allow families to receive a device or internet help if they need a device that is, you know, able to do a Zoom call with a doctor, that type of thing. And they're like an Amazon Fire tablet. I'm not sure how much funding we have left to do this, but until it's gone, give me a call if you have anybody, and I'll let you know if we do.
Well, then Tina, let me just put a plug in as well that Integrated Services has placed hotspots and Chromebooks. There are some at Utah Parent Center, some in Ogden, and we have them at 4 rural health departments with which we contract. So down in San Juan, Central, Southeast, and Tri-County, we have Chromebooks and hotspots that we can loan out to families as well to complete any sort of telehealth type visit if folks are really lacking in technology. The only time it's problematic is if you live in an area where cell coverage is horrendous. It doesn't really matter if you have a hotspot or not. So in our rural areas, families do have the option to use the local health department as a place to have any sort of a medical or behavioral health visit, a conference with school or whatever. Our care coordinators can help make that happen and set aside a place and a time at the health department that would be HIPAA compliant and assure some privacy so families can have those types of visits.
Oops, sorry. That's great news. That's really helpful. So Tina, let me just clarify, it's Utah Family Voices that has the grant for the device and potentially the internet.
So we've got both. We've got help from the Integrated Services team to do these, and we can provide a nice space for a family to do a visit if they need to.
Very nice. Okay.
You know, sometimes we have families that just are not tech savvy and they need to come somewhere and do it. Those type of things. So, and then, like I said, this is a Family Voices grant that we also have available. And those are devices to keep, and it's a limited amount of internet. But there are, let me see if I can find the link for you guys. There's a list that UATP has on their website, and they've got a couple good resources for kind of the rent, utilities, internet, all of those things that people are having a hard time with right now. And so I can send you that. Hang on, I'll find it.
Great. The silver lining from the pandemic is the telehealth, and it sounds like maybe it is continuing a little bit in terms of, you know, Cigna being okay to reimburse for the LCSW visits or what have you. So fingers crossed that might be some positive out of all of this that continues. So Tina and Eric have posted in the chat with regard to connecting for those devices or other resources around families needing a place for a visit or help for a telehealth visit. Well, thank you, Tina. Great. One more in the chat for resources for rent, utilities, and internet. Okay. Oh, that's great. Well, we'll make sure that all of this information gets gathered in our notes. And if there's anything that needs to be updated in our services directory regarding these programs, we will do that as well. I think what we heard from Codie with regard to her program's interest and willingness to really communicate and be a part of what's going on with a family and a child's primary care team and their school is really heartening. So it sounded to me like, you know, getting those releases of information can really open some doors and help see some progress happen there. So hopefully that's an important takeaway from today's meeting. And yeah, the list of contacts, we'll make sure to get that from Codie. I know that that's something we've tried to provide in years past, and there's always some changes to those contact folks. So we'll get the latest one sent out to you and posted on the medical home portal as well, so you can find it there. All right, anything else before we say goodbye on this rainy Wednesday? was really great to see all of you, and just want to reiterate that you can use this listserv in between meetings. So if you ever have questions, need help, want to just, put something out there, this is the way to do it. I said stay cool, but now I may need to say stay dry. Thanks, everyone. Have a good rest of your day.
Thank you.
Michelle, you want to stay on for just a second? Okay. I think we can probably stop recording.